The time is 6:19, time to go in depth. By the time this segment is over, one person will have died of a stroke. It's the leading cause of death and disability in the U.S. and here in Oregon. Most folks don't know how to recognize it or just ignore the signs. So how do you know if it's a stroke or something else?
Joining us now is Louise Jenkins, a nurse manager at Providence Stroke Center. Hello, Louise.
Good morning. How are you this morning?
We're doing well, but we probably could use a reminder on what a stroke feels like, really.
Absolutely. We'd like to remind people that the early warning signs of a stroke are relatively easy to spot. We teach people to think FAST, F-A-S-T. And that stands for if someone, you ask them to smile and look at their face and notice if one side of their face droops down. Ask the person to hold up both of their arms evenly and look and see if one of their arms is drifting down, or maybe they can't move it at all, or they might complain it's numb. Ask person to repeat a simple sentence and notice if their words are slurred or jumbled or they don't understand what you have asked them to do. And T stands for time. If the person shows any of these symptoms, and these are a sudden onset, it's important to call 911 immediately and get the person to an emergency department so they can receive the evaluation they need to see if it is a stroke.
Well, Louise, are there conditions that can mimic a stroke and might confuse a person as to whether they're actually having one?
Oh, yes, there is. Headache is a common symptom that can be dismissed by many people. Oftentimes, people mistake their stroke for a migraine. But it's the headache that hits you all of a sudden, very, very hard, often described as the worst headache of your life, is when a person needs to take action right away, call 911 and get to the emergency department.
It sounds like even if you kind of suspect you're having a stroke, you should do something, because what's the worst can happen if you think it, but underthinking it is the worst part.
Absolutely. Getting to the hospital right away is really important because strokes can be treated with a clot-busting drug called TPA within the first 3 to 4 hours of the onset. Past that 4-hour time limit, the clot may have to be surgically removed. And it's very important to get there as early as possible because every minute clot is being blocked in someone's brain, depriving it of oxygen, you're killing 2 billion brain cells.
Oh, wow.
It's a severe disability.
Got to take it seriously. Louise, thank you.
You're very welcome.
That's Louise Jenkins, nurse manager at Providence Stroke Center.